Hey, how you guys doing? You got your masks? Did Omar text you to come in? It takes to come in. So go ahead and open the door.
Good evening, Dr. Ahuja, and good afternoon to Lynn. How are you doing?
I'm fine.
I'm doing great. Doing great. Dr. Jalen and Dr. Phillip, how are you?
Yeah, I'm fine. How are you with you, man?
Doing great.
You guys had
Hold on a
negative.
second. I'll try to share the
You're in
screen.
the clinic. Everyone needs to wear a mask. And Melissa, you want to take?
So, Dr. Ahuja, what happened? You mentioned me. Someone is just in your family.
Yeah,
turned
actually,
positive.
one of my relatives, they are in Delhi only, and they have turned out to be positive. And not only the guy who is positive, the entire family is positive. And even the house where I'm sitting right now, just back to me, one more house is there. All the five members have turned out to be positive. Similarly, after
And
4 5 houses from down the lane, again the five patients within the same house, they are getting positive. So I think the community transmission, or what we called the you know rapid surge in the cases, we can see right now in Delhi, because the number of in testing we have increasing these days. Now we have 34 labs, 17 from the government lab and the 17 from the private lab. So
Yeah.
I think the more testing we are doing it, the more cases we are getting isolated these days.
Well, I'm so sorry to hear about your family. What are the steps that they're being told to take right now?
Actually, the government, what they did is they have placed a poster which showing that they all the family members, three or suppose there are three members are there, so all the three are positive, and they need to be quarantined or so isolated for the another 17 days. And if they require something, any kind of help, any kind of the medication, or any kind of help in the form of ration or something like that, uh, food material, they have to be supplied by the government official only, but they don't have to step out of their home, and they need to be strict isolation as per government rules. Another thing which they
Or
mentioned about that is, pardon me, please, you want to
did
say
they have
something,
the
Ankit?
antibody test or the nasal swab test?
How did they
They
test him?
Yeah, the testing is two types in these days in Delhi. One is through the home, they collect the samples, and second is the drive-through mechanism. I mean, the person who is have symptoms, they will go through by car and to a designated place at a particular time, which is given in the message box, in the text box, and by going to the center, the sample will be collected while the patient is seated in the car only. Is being seated in the car only.
Yeah, but what
So
sample are they taking
yeah,
it from the
I
nose
am coming.
or
I'm
the
coming to that.
blood?
So
Yeah.
most of the samples in the labs are by two ways. One is by nasopharyngeal, and third is by throat swab. So no blood testing is being done these days. In as so far in India is concerned, we are doing either the nasopharyngeal swab or both throat swab also.
Wow.
Yeah, I think if you're going to do the PCR swab test, you have to do
Yeah.
it both nasopharyngeal and the throat, because you're testing to see if you have a colony of the virus, and if you just test here, you might miss the colony here. Yeah.
Yeah.
But
So
then, even if you test both here and here, you might miss a colony in your mouth. So I think they should do both nasal,
so most of the
mouth,
labs,
and the antibody test, just as a second measure. But that's what we need in the US. We need more broad testing where you can do the sample at home and they could pick the kit up, or we could send it to a lab like LabCorp and get tested. But that takes several days. So the blood prick test seems more practical because you could ship it to their home. They prick their finger. It's like a pregnancy test or cholesterol test. You send it back, or through an online telemedicine consultation with a healthcare provider, you can determine if they're positive for the antibodies or not. So yeah, I think there's a lot of ways to do it, but we want efficiency and we want speed.
I'm
So
curious too. When were they tested? When did they actually do the test? And how long did it take to get the results back?
So actually, what happened is there is long queue is there. Whether you go into the private sector or you go to the public sector these days. So there is a waiting period of around 2 to 3 days, depending upon the lab to lab, and minimum at least 48 hours waiting period is there in most of the labs. And as Dr. Philip has already said, we need to check both the oropharynx, that is the throat part, as well as the nasopharynx through the nose part.
Wow.
So
so
as far as yeah,
so did they have any cold or flu symptoms? Your relatives who tested
yeah,
positive?
actually, so most of I have gone through testing of my three relatives today. So it's not today. The result have come today. Yesterday I did it for my testing. So what they have symptoms is out of three, two have the symptoms. One daughter of 3 years and husband and wife. Husband is showing the symptoms of fever, cough, sore throat for the last 2 days, and the wife is totally asymptomatic. But as a dictum, patient who is in coming in close contact of the who is having these symptoms. So I have gone for the testing of all the three members, and they have turned out to be positive, all the three.
So are they getting
What kind of
any
medication?
standard treatment? What treatments are they getting, if
Yeah.
at all?
Oh, that's what he's getting to. Yeah, that's
Yeah.
what he's getting to.
Yeah. So as far as the all the two husband and wife, they are young, around 30 years plus, and the kid is very small, around 3 years old. So in kid, only symptoms are like uh, just fever. Kid is not coughing up. So for prophylactic point of view, or for superimposed bacterial infection, I have just prescribed in Jatin or azithromycin. Nothing like any hydroxychloroquine or something like that new drug. So for that kid. But if you talk about the adult, yes, I have put him the man into the hydroxychloroquine as well as the azithromycin, because right now we have hydroxychloroquine in India. Remdesivir soon will be going to available in the Indian market, but right now we don't have it. And also remdesivir is, we know that from the data, it's been used in the severe cases. So the patient who is having very mild symptoms and
Yeah,
those
they
who are
shouldn't get it.
asymptomatic,
Yeah.
so that we don't require them to give to the
Yeah,
this
so
remdesivir.
So
I
you're
belong.
talking about antibiotics too. Erythromycin. You're talking about antibiotics too. They're
Yeah,
u-
antibiotics to prevent the superimposed bacterial infection in the throat, because we know that the
They
most of the
offer disease
patients who are
packages. Mhm. But
Wow.
yeah,
yeah,
we belong to the American Academy of Stem Cell Physicians. We're coming up with guidelines that we're going to send to the president, and hopefully he'll get it to the CDC. Hopefully he'll listen to us. So if you're tested positive and if you're asymptomatic or very mild, you just need high dose vitamin C, oral or infusion,
yeah,
ozone therapy, and vitamin
yeah,
D3, zinc, and something called
yeah.
monolaurin.
So
It's on the wall of the viruses. If you're stage 2, which you have mild to moderate symptoms, cough,
yeah,
fever, sore throat, maybe some coughing, some mild cough symptoms, you probably need something called methylene blue, which it can kill the virus if you swab your nose, get it in your mouth with UV light. It's a mouthpiece that they use to
yeah.
whiten your teeth, but the UV light can activate the methylene blue. It'll kill the virus before it can get down deeper in your throat. And then stage 3 is severe cases. They have some fibrosis in their lungs, difficulty breathing, decreased oxygen saturation. They need something more aggressive. Ideally, umbilical cord stem cell therapy, which can immunomodulate the immune system. When you IV stem cells, 99% go to the lungs, which is perfect. Yeah, there's studies in China where they were using the umbilical cord blood. They've been reversing the COVID symptoms with totally in 2-3 days. So there are several labs doing that umbilical cord stem cell and natural killer cell therapy for COVID in the U.S. And then if the natural approaches don't work, then we could talk about erythromycin, hydroxychloroquine, maybe remdesivir for more severe. Of course, oxygen too. Hopefully hyperbaric or an oxygen mask for moderate to severe. But intubation, that's like last resort because it's hard to breathe. Only has a 20% survival rate. And then, and then the supposed vaccine, which, probably take 18 months, which is a mute point because the virus is already mutated. So why are you going to put a vaccine with no safety measures or testing on something that's probably not going to work on a mutated virus? So these are the conservative measures our academy is presenting. We're actually practicing in our patients. We just think this should be a national or even international standard. But the WHO, they don't talk about all these natural alternatives. They only talk about the hardcore drugs
So
and
maybe
vaccines.
some of that is something we could collaborate with India, especially with Dr. Jatin, sharing a real life experience, right? Is that we can take some of this data, Dr. Yu, and institute it into some of the conversations you want to have, that the natural applications are working just as well. But I am curious, how have they asked the family, because you're such a tight-knit family in India, how are they reacting as a family? Certainly those three are kind of isolated, but what about the rest of the families? Are you guys being tested and things like that?
Yes, yeah, you are right. Actually, this is just a social distance or social isolation, not the emotional isolation. I know that the time is really very tough these days for entire India, and especially if you talk about the metro cities like Delhi and Mumbai, they are hardly hit by this virus. And what we do it, we what we do it that apart from the prophylactic antibiotic, I have also given him, as per Dr. Philip, vitamin C. I asked them to take a lot of gooseberry. I asked them to take a lemon water. And the third, just to boost up your immunity. And the third, a lot of hydration. And third thing, which I asked them to take a zinc supplement, because
Yeah.
we have, yeah, zinc supplement. As we know that most of the studies from the previous viruses, like from influenza, polio virus, that zinc has the antiviral property. It's a general antiviral property. It inhibits the replication of the viruses. So as a short duration, 5-10 days hardly matters for giving the, even I have this strip of zinc. Yeah, so I
Oh,
used to take it. Yeah, I used to take it occasionally, just to supplement or immune my body, make my immune body to the virus. But
40,
we never know.
40 milligrams a day, right? About 40? How
Pardon?
many milligrams a day are those tablets?
Yeah, I used to take around 50 milligram per day.
Yeah,
But
40,
the studies
50.
yeah, studies which is
It
being
breaks
done in
down,
the,
it interferes with the RNA transcription of the virus. They can't replicate. Breaks down the wall. Yeah.
there you go.
Should we also
but
use zinc tablets then?
pardon, Ankit.
Should we also use zinc tablets to boost immunity?
Yeah, zinc is not as a immunity booster, but definitely it has the antiviral property. Suppose you don't know, I'm an healthcare worker. I'm going to the daily hospital.
Okay.
I never know that I am getting contact with the patient. I may not throwing the symptoms right now,
Yeah.
but who knows that I may be asymptomatic carrier? Who knows that
Exactly.
virus is in my body?
I'm concerned about my father because he used to go to dialysis twice a week, and you know that he visits Max Sake. So I'm just concerned that can he take those zinc medicines?
Yeah, there's no harm in taking zinc as an alternate day. I used to take it on alternate day basis only. 50
Okay.
milligram, very minimum requirement. For though studies which has been done in the initial part from Wuhan, it suggests that 50 milligram you have to take 4 times a day. That is total 200 milligrams for the better action antiviral property. But but that is to be given only in proven cases. I am not a proven case right now,
Yeah.
so I don't want that I should take it 200 milligram on daily basis. And
Yeah.
how long I keep on taking it? So what I do to myself is I used to take it on alternate day or twice weekly, just to make it could be might have a placebo effect also. I don't know the exact.
No, you could just take the vitamin C zinc lozenges. You know,
Yeah,
and
sure.
I think Ricola has that, right, with the honey, and just suck on that every day as a prevention.
Absolutely.
And if you happen to get virus or bacteria in your mouth or throat, that might kill it before it goes down to your lungs. So, yeah.
Yeah, the zinc and vitamin C, all of that, those just good, healthy alternatives. The thing is right now is that now you're having to address family has it, who have they been around, who's asymmetric, who isn't, and I guess everyone needs to start getting tested. How long do they suspect that the family members have had this? How long do they suspect?
So things are like that. Patients who are getting these symptoms, suppose I am in 3-4 families in my contact, those who are throwing the symptoms of fever or mild sore throat, the most of the patients, they, if I ask them, is there any positive history of coming in contact with a positive person, none of them having the history like that. But definitely yes, they have the history of uh, coming in contact with one of their close friends, or somebody is visiting their home, somebody is providing the vegetables, fruits at their doorstep. So things are like that. So whenever the in Delhi, symptoms, sorry, the disease is so severe these days, those who are throwing the symptoms on a upfront, we are going for a testing. And not only the testing part, we are also boosting them that you don't have to worry. 80% of the patient, the virus doesn't cause any symptoms, but any not symptoms, any complication. You got the fever, got the sore throat, take care of your immunity, the virus will be gone. That's the thing, I think, the most important part. Rest 20% of the population, you may require hospitalization, you may require a ventilator support, but that is negligible, less than 2%. And that too depends on the age factor, your prior comorbidity, your prior asthmatic condition. So these are the conditions which are posing the real threat to the COVID-19. But I think the young population, those who are less than 40, without any hypertension, without any
Yeah,
coronary
we're
artery
talking
disease.
about that. Yeah. Let them go out and work
uh,
and be functional.
yeah.
Yeah.
No, and I think that there's a balance, and then there's checks and balances we need to be doing just to stay ahead of it, right? Just like we do if you have pain, stay ahead of the pain. So we know a lot more about this than what we did 3 months ago, and I think that just by doing the common everyday practices and boosting up our immunities, but staying ahead of it, testing. I think we still need to test just for screening purposes only, just like we do screening for HIV, right? We've never found a cure for HIV. We have never found a cure for Ebola. But when we know something doesn't seem right, we start screening. You screen to do what? To early detect and isolate and treat. Those we do the same thing for cancers, right? We screen for cancers. And we do that for what? Early detection. So that we can treat, maybe.
That being said, we were talking about the infrared cameras, right? They're on drones, and they could see if you have heat.
Yeah.
Like the movie Predator, where he has an infrared camera in his eyes, and he could see if he has health. Well, that's how they do mammograms. It's an infrared camera, and if you have inflammation there, you're at risk for cancer. So we could easily install these infrared cameras to see if you do have a fever. We can also use a non-contact infrared laser thermometer, and it's just a screen. I mean, you could have a fever because you ran, or you have another infection, but there are some conservative measures we can take to keep the public safe.
Well, I know that in those infrared screenings, they also know that you can have spots, right? Hot spots or spots that could be other things going on, and then you should address those. And I shared with the crew here earlier today a what they call early detection screening system that does that. It scans actually just the breast areas for abnormalities. It's not about detection as much as it's early screening to go see your doctor if something is abnormal. But you can, instead of the old-fashioned way where you can try to feel for it, which is very, very hard to do, it just screens you every day. You just take the screen and artificial intelligence tells you if something has appeared abnormal that doesn't need to be there. And it's all infrared heat sensor screening. They're still working on it. But these are technologies, like you said, like the drones, they can scan the crowds. We have,
why can't we enable those cameras on our doorbell, maybe on Ring, what you use outside your door? I mean, so whenever you come out, scan you and then you can share the data with the doctor.
Yeah, we have on our iPhone, you can plug in the infrared thermography camera, and it'll scan your body to see what parts of your body have inflammation. Like we do it to see where you have pain. So if you have a signature on your knee that's really yellow, which means really hot, like the sun is really hot, it gets yellow. Then we know you have inflammation there, and that's where we treat you. That's where we put the stem cells. The stem cells are like firemen. They're going to go where the heat is, the inflammation. So yeah, there is a lot of technology that you can just put on your iPhone, and then we want to make it where we can monitor the patient from home, because we're doing a lot of telemedicine consults. We want to make sure we have some type of system to monitor their health at home. How much inflammation do they have in their body? So we could tell them the treatments virtually. This is where medicine is going, because people are afraid to go out and get infection going to the clinic or hospital here. And I've been doing a lot of telemedicine video calls, and a lot of patients like it because they could do it from their home, or they go to the clinic. They sit in front of a computer screen. I can consult them from my home, so I can stay less stressed. I could service more patients without having to drive to all these clinics. So actually, I think that's where medicine is going. We can monitor your health from home. Let's send your test kit at home, prick your finger. If you have IgM, you've had a recent COVID infection. You're shedding the virus. You're infectious. You should quarantine. You have IgG. That means you've had the infection for more than a few weeks. You don't have symptoms. That means you've developed immunity antibodies. You're probably safe to go out and work. But make sure you're taking your supplements to stay healthy. So yeah. Anyways, I gotta go finish out my podcast. We'll see you guys tomorrow at 9 a.m. at Super Stem Cell Saturday. All right.
That's right. STEM Super Saturday. Stem Cell Super Saturday. Thank you. Bye, Dr. Yu.
Thank you.
Say that 3 times. Wow. So I'm very sorry for your family's experience, and thank you for sharing with us. That's got to be very scary.
Yeah. Thank you for the concern. Now I think the level of transmission has gone to the different stage in India so far, and that is not into the entire India, but I'll say to the certain cities of the India. I think today the government also has declared there are certain cities, like 13 cities in India, and those are the cities where we have more than 70 to 80% of the infection, which we are looking into it. And rest of the states or the cities in India, they have very low transmission, even negligible. We are hardly seeing any cases. But if you talk about the hotspot areas like Delhi or Mumbai or in the Maharashtra, different cities are there. Definitely, we are having the very high number of cases. Last night, we have more than 1,000 cases being recorded within a Delhi within the last 24 hours. So I think starting from less than 50 cases per day to more than 1,000 cases per day, Delhi is creeping. Larry graph is creeping very slowly to a another level.
So do you think, though, that a lot of the increase is just purely because we've increased our testing? So, of course, we're going to know that there's more infections out there because we're able to test more. Perhaps maybe that all of these infections, if not more, exist out there. But, our numbers are going to change and increase until we're able to test everyone, right?
Yeah. Yeah, there are multiple reasons for that. One thing is definitely yes, we have increased the number of testing. Second reason is that just after the third lockdown, there's a little bit of eased up of lockdown is there. There's a lot of permission which has been granted by the government. So a lot of traffic again has been resumed onto the roads. So there are a lot of public these days onto the roads, and since many of them are using masks, few of them are not using masks, and also it's very difficult to make everyone understand the importance of mask, make importance of the hand sanitizer. Yes, people started recognizing it, acknowledging them, but still it's very difficult to the city of 2 crore population, more than 2 crore population in Delhi, a small city.
Well,
So it's very difficult to cut through to contain the virus. It's very difficult. Now initially India has also started to start the aviation also, but now I think they have again put a little bit of pause also. Only very limited flights are going though these days. So these are the things already WHO has warned many countries that easing up early could be dangerous. And still we are very, very far for the development of herd immunity or development of vaccine in the near future. We don't think so that within 2 months we'll be having the herd immunity, we'll be having, the vaccine in our hand. So there are a lot of concepts these days are going that we have to stay with this virus. Definitely, we have to stay with this virus. We don't know how long we have to stay with this virus, but we have to change our practices. How we have to get out of our house. Do you have to change our mask on daily basis? Do we have to clean our hands on every frequent object we are going to touch? So these are the things which doesn't come within a day or week or month. It takes time. So still I think India is struggling hard to inculcate those practices.
those aren't easy practices for our way of living in this day and time. For some cultures, the disciplines are not as difficult. In the U.S., we struggle with those disciplines, and
Yeah.
our numbers show proof of the fact that we lack that discipline or ability to do that discipline. The fact that we slightly opened and gave the orders of no more than 10 people at an event, and over the weekend, one of our places held an event with 4,000 people crammed together, is an indication of how our country is not respecting the disease and the impact that it's going to make on our lives. It's very disappointing. I'm not going to politically get involved in the arguments over this because people feel like they have a right. And my thing is okay, if you corral all those 4,000 people together and they get sick, do you treat them? Do we have to treat them? Should we liably, if people are being irresponsible? Whereas you've got people who are trying to be responsible, maybe didn't go to that event, but has to go to the grocery store, and they're taking all the precautions they can. And one of those people come into that grocery store, and then they get that person infected. So I mean, people are just not being conscious about the mass impact because it hasn't affected them. I think, go ahead, Ankit.
Dr. Jatin, I have one question that everyone is saying that young people like me can go out and work and then we can come back and we have that immunity. And in very few cases, someone can caught COVID positive and then they have to undergo the diagnosis or treatment. But suppose if I'm going out and I am coming back and my family is living with me and I'm not having that infection, but I can still spread infection to my family. And I am
Yeah,
safe from COVID. I might be test negative, but they test positive. And that's what's happening in India. That is what I mean. I'm talking to a lot of people. The person who is going out, he's fine. But the person who is living in the house, they are having the COVID positive cases. So, what are your thoughts
yeah.
on that?
This can be happen to anyone, either you or me, those who are getting out of the
No, I
houses.
agree.
And yeah, and we never know that whether which category. I think we have already discussed earlier also that which category we are going to fall, whether it will be asymptomatic, very mild, moderate, or
Yeah.
a severe one. Yeah, and we never know also. We could be a, asymptomatic carrier as well as spreader also. We
Yeah.
can be threat to our own family also. So what happened is that, provided, if since you talking about me, that yeah, around 1.5 week back, last Monday, one of the healthcare worker has symptom of fever, cough, sore throat, and she was adamant that, hey doc, if you are going to examine my throat, then only I will show you my, that consult with you. Otherwise, I'm not gonna come to you and have my consultation. So are you willing to check my throat? It's really paining, and I need to check it whether it's any foreign body or any kind of ulcer in my throat. So it's very difficult to check anyone's throat these days, and that too is a
Yeah.
very close focus. So, but since I have PPs, my N95 mask, my face shield, I examined her. I asked her, the moment I asked her to, just open your mouth and say, ah, I have a torch in my hand, one hand, and I have one spatula in my one hand. The moment I say her, just open your mouth, she started coughing up. The
Oh no.
Oh,
mask was here and she started coughing up.
Oh
You
no.
my
can
God.
imagine, my state. I asked her, ma'am,
Oh my
please do,
gosh.
yeah. And
Even with
this is not,
PPE. Oh my gosh.
and this is not enough. This is not enough. Things things gone wrong. I examined her in the morning around 1 p.m. in the morning. Late in the evening around 9 p.m. I got the call from the my medical officer. Hey, Doc Jatin, do you know that you examined one female nursing staff in the morning? Yeah, I know. I remember that girl. So she has turned out to be positive.
Oh
Oh my God.
no.
Oh, no.
My my brain suddenly stopped working. So I
Because
don't know
what
what
do?
to do
You
now.
start thinking,
So
what did
did
I
you
do
undergo the
wrong?
testing, sir? Did you undergo the testing?
No. So what happened is I quarantined myself for the 8 10 days. So I didn't step out my house, but I did it to myself for my
Family.
my family members, because I have two small kids. So
Yeah.
I used this N95 mask, and I have one sterlium also. This one, this I always keep with me. These two things.
Okay.
So whenever my kids, come close to me, so I always scrub my hand and use this N95 mask, so that I don't get, transmit my virus to them,
Yeah.
because maybe, I may be asymptomatic. So
Yeah.
this
Certainly.
thing I continued till now also, because still now I'm asymptomatic. I may be asymptomatic carrier also. I may be, but being a healthcare worker, and we keep on coming across these kind of patient on daily basis. So what should be my initial point? Government says you have to, those who are asymptomatic healthcare worker coming in a contact with a positive person, they have to go for testing in between day 5 to day 10 of the exposure. But my exposure is on daily basis. So should I go for
Yeah.
keep on testing on daily basis? It's impossible. It's impossible. You
No,
know,
we can't, and you can't determine how
So,
it's.
Dr. Ahuja, when was your last testing you did it?
No, so what I did is I didn't go for my testing so far, but what I followed is I've used full PPE kind of gown, and when I examine these kind of patient, I have my gloves, I wash my hands regularly, I have a full sheet, uh, and underneath the full sheet I have N95 mask, and above the N95 mask I used to wear the 3M ply mask also. So there are three
All that.
protection I used to take it. So yeah, so level of exposure was my minimal, but somebody is coughing directly on your face.
Oh no.
So
Oh my gosh. But here's what I gather from you, and because you are an infectious disease doctor, the important elements of all of this isn't just so much about protecting yourself from getting the disease as much as, if you think you have it, to wear the mask to protect others. The wearing of the mask is more about protecting others. And God bless you for having to be around a woman who's coughing and sneezing and
Yeah.
spreading, and you're still there serving them. There's nothing we can do to prevent those incidents from happening, but you've said you did all the precautions necessary, and it sounds like it worked, right? it sounds like all of your cautions, the shields, it sounds like it worked.
Yeah.
Thank
So
goodness.
what happened? Yeah, so what happened is these exposures are what we are going through on daily basis. And being a healthcare worker, being an infectious disease specialist, we cannot say that okay, now we don't want to work in the battlefield. We need to work in the battlefield. If not we, then who else will going to do this thing?
True.
Who else will going to do this thing? Uh, Somebody has to fight in this battle. And yes, there is a risk. There is a risk to our family also. And but this is not what we are battling in this field alone. There are certain police personnel who are also battling in this COVID pandemic. There are certain other paramedical healthcare staff members. There are a lot of janitors, those who are working in the hospitals premises. So many persons are there, those who are battling in this COVID-19 pandemic, and all are under threat on daily basis. The moment we get up in the morning, we open the TV, we listen to hear about that. Oh, this is one of the famous doctor. We have lost this doctor. Similar with the states also. The moment we open the Twitter account and we come to know that one of our Infectious Disease Society of America, one of the famous eye docs, one of the famous nephrologists, one of the famous internal medicine doctor have lost their life. So it's in all over the world, healthcare workers are at risk. And the good part is this, that now we have certain amount of uh, improvement with the remdesivir. The remdesivir could be a rampant, which we call the holy thing for our. It could work in our scenario also, as which we are getting data from the states also, from China also, from European countries also, that remdesivir could be of help. And now India have started this manufacturing of remdesivir with the help of collaboration with the Glade Pharma. Two companies of India, Cipla and the Hitro, they have started developing it, and soon we will have this drug in our Indian market, so that patients who are developing very severe disease, they could be survived.
Well, and I think that we're going to find as we move forward that a lot of the answers are going to be just as simple as other medications that we've been treating with, like Dr. David Mockowitz has discovered that he's treated his patients with just asthma medications and adding
Yeah.
a supplement of quercetin, which I started taking quercetin just to see if it will help me increase my energy. So I think as we move forward, because all of these medications, just some of the ones that you discussed earlier, they're about treating infections. They're about treating, inflammatory. They're about treating all of the things that actually happen as a symptom from the disease or virus. And we learned today it's a disease and a virus, right? There's two things. You can have the virus and you can have the disease, and that was very eye opening to me today. Um,
Yeah.
so I think that
Let me clear you. Yeah.
Go ahead.
Sorry. Let me clear you two concepts over here. You might be heard about the name of tuberculosis, though it's very rare in United States. It's quite common in Indian scenario in developing country. So what happened is, the moment the child born in the the newborn get you delivered in the Indian setting or in a developing setting, within a 1 month or 2 months, he may get exposed to the tuberculosis bacteria. But happen what is, it gets bacteria gets into the lungs, and it gets engulfed by the macrophages. It resides in the lymph node. This is what known as uh, infection. This doesn't mean that tuberculosis in my lungs that I have the disease. It is just a latent infection, what we call as the latent infection. But the moment my immunity goes down, the bacteria gets aggravated, and it leads to development of the TB, tuberculosis disease. So what we are looking into the patient, we are looking into the tuberculosis disease patient, not the TB infection patient. Same with the this kind of virus, though virus potency is not known. There is no term like latent viral infection with the COVID-19. But there is a term known as asymptomatic COVID-19. Virus getting into my body, getting in the all the circulation throughout my body, but it's not causing harm. It is not causing any kind of my organ damage. So this is asymptomatic COVID-19 infection, and but they are the one who are very risky to the other person, because suppose if I don't have symptom, so I may be a transmitter. I can transmit to Ankit. I can transmit to anyone. Because if I don't use mask, so
Yeah.
mask is mandatory, irrespective of Ankit's symptoms or mine symptoms, irrespective. You can't ignore the mask. You can't ignore the hand hygiene part.
Yeah.
So it is, it's a new thing for the our generation, or maybe the upcoming generation in the near future, that masks are mandatory. We need to consider that this, it's our one of our, privacy part. We need to
I,
hide this privacy part.
I agree with you, and I hate that we're probably going to have to wrap up here in a minute. Can you come back tomorrow and finish this more